Hello and welcome to Western Perspective. I'm Nelson Liu. Well, it's not talked about much, but it hits our elderly community hard. Experts are warning about the prevalence of abuse on our older Australians, saying it's shocking how much it takes place. After pushing the issue for 2 years, one politician says the state government has failed our elderly. Sarah Smith reports.
Because when you start finding out about this area, it's really shocking how much it goes on.
Few people underestimate the devastating impact of child abuse, but there's another less well understood form of abuse taking place in our communities. Older people are one of the most vulnerable groups in our society, and experts say up to 15% of those over 65 could be experiencing abuse. Deirdre Timms is the CEO of Advocare, a not-for-profit that provides support and advocacy for older people. Last year alone, there were 1,200 calls to Advocare's elder abuse hotline, and Deirdre says that's only the tip of the iceberg.
If we take the upper end of that, we're talking, somewhere between 50,000, 60,000 people.
Barbara Blundell is a senior lecturer in social work at Curtin University. She says elder abuse is usually perpetrated by those closest to the victim.
It's a horrible statistic that most elder abuse is conducted by family members, so usually the children or stepchildren of the older person, but sometimes other family members.
It can take many forms, from psychological to emotional to sometimes even sexual abuse. But the most reported form is financial abuse.
So it can be anything from borrowing older people's person's key card, perhaps going to the bank, withdrawing a little bit of extra money for yourself, or buying groceries, getting a few extra things for yourself, to actually putting pressure on the older person to sign over an enduring power of attorney so that you have power over all their financial and legal affairs.
An enduring power of attorney is a legal document that lets an older person give someone they trust power to make legal and financial decisions for them when they can't make those decisions themselves. But sometimes this goes wrong.
We often see abuse of powers of attorney when the person who has the power believes they have the right to make financial decisions in their interests. And those financial decisions should always be made in the interest of the older person.
Nick Guran is a member of the Upper House in WA. In 2018, he headed up the Select Committee for Elder Abuse. In its final report, the committee made 35 recommendations to the government about legal changes that could help to protect older people.
We can do something about the powers of attorney. In Western Australia at the moment, there's no central registry. The banks would like us to be able to have that so that they would be able to check if the person coming in actually has the authority to be able to make the decisions on behalf of the other person. There's no proper register to determine whether a person has revoked that decision.
At the time, the government said they accepted all but one of the committee's recommendations. But to date, no bills have been introduced to Parliament to rectify the issues identified.
We've got people every day who are living in a family environment where they're either being financially taken advantage of, or alternatively, emotionally or psychologically, they're being taken advantage of. And in some cases, it's in the form of physical abuse, and disturbingly, some is even sexual abuse. Now, this is happening day in and day out for some of these people. And what are we doing collectively as a group of leaders in our community to do something about that? Now, if we can't even get a bill introduced into the Parliament, then unfortunately, I think collectively we've failed.
Deirdre says those changes to the legislation need to go hand in hand with a change in the way we look at older people in our society.
We actually need a really well-resourced state campaign, and that campaign really should be addressing the underlying causes of elder abuse, and that is ageism. As a society, we have very little respect for older people.
Stamping out elder abuse is something we all have a role in.
The strongest message we can put out there is that we want everybody to take some responsibility. Elder abuse is everybody's business. If you see it, don't walk past it.
And now, the AMA-WA's President Dr Andrew Miller provides his weekly COVID-19 update.
Hi, thanks for your time and the opportunity to say a few words about COVID this week from the West Australian perspective. All attention on Victoria, of course, trying to bring their case numbers down, and you'll see that the effect of the lockdown now, they're about 4 weeks into it, is that they now have bent the shape of that curve. They're getting about 180 new cases a day instead of the over 500 that they were getting, and that's exactly what you wanted. So you think, well, this is great, isn't it? We can all sort of relax. Well, the trouble is that only happens if you're locked down. So unless you can get the case numbers back to near zero before you open up again, and then you manage to track and trace everybody who has the infection once you open up again, then you go straight back to lockdown in a period of time when your community spread gets out of control. That's why we're anxious to understand in Western Australia what is our tracking and tracing capability. This is the question everyone should be asking, because our community is really open. So if a truck driver or a flight attendant or a pilot or a person returning from overseas for some other reason is in our community and it starts to spread, if it gets out of the hotels because it can be a wickedly infectious disease and one of the workers there might get it, as they have in several other cities, then how easily we're going to be able to track it down to avoid a completely disastrous lockdown. And that's something that we don't completely understand at the moment. And of course, governments don't want us to panic about it. Governments don't want us to hear bad news in general, to be honest. So I really think that we need to get some proper answers to those questions. In terms of preparing our aged care facilities, I think we're only just starting with that. We're no further ahead than Victoria was when it began there, because this has been seen as a Commonwealth responsibility. Of course, they look after aged care, but the Commonwealth don't have people on the ground who can go into aged care and help there. That's got to be the state hospitals. And once you send state hospital nurses and other workers into these facilities, then you risk the cross-infection if there is COVID in there. So there's a lot of problems to be sorted out within aged care yet. As far as healthcare workers getting infected is concerned, we have the disastrous situation at Frankston Hospital, about 80 infected doctors in that particular location, 45 of them junior staff. And it's difficult to believe that they've been given a safe workplace when they're getting infected at 4 to 5 to 10 times the rate of the general population around them. In fact, it's so difficult to believe that no one believes it, and eventually the Victorian government's come out and acknowledge that it's not the case, that they're getting it on the bus. They are getting it at work, and we do need to improve workplace safety. If workplace safety on the mines was the same as it is in hospitals, the mines would be shut down. Safety is just part of the culture. We all know about the very careful attention to safety in that industry. And why is that? Well, it's because the law holds the managers and the owners, the directors of those businesses, personally responsible for worksite accidents. And you can end up with very severe financial and criminal penalties for not having a safe workplace. Now, that is exactly the situation we're in. In health, it hasn't traditionally been a problem, people getting injured at work like it was in the mining sector. So we've been pretty slack on it. We haven't done the work that we should have done in making sure that our workers are safe. So there's no arguments here. Who's responsible? Well, the people who run the system are responsible, and their managers are responsible to respond to safety incidents. So what we'll be doing is we're going around and we're asking all the hospitals, what risk management do you have in place? And it's a simple hierarchy of controls, starting with eliminating the risk, keeping it out of there through testing and so on, and sending people elsewhere. We then have the engineering. Have you got the right kind of air conditioning and spaces you need to run a facility that's going to handle COVID? Administration. Have you rostered on an adequate number of people? Have you got all your protocols in place? Have you got the right amount of cleaning happening every day to keep this a safe workplace? We've got a new study out this week that shows that we know we can pick it up off surfaces, but it certainly can aerosolise to get to other surfaces in fairly distant places. Don't want any more arguments about that. Now we've got a whole lot of infected healthcare workers, just fix it. Then you move from your administrative type controls to your substitution, things like telehealth, where let's get more of that happening. Let's forget this kind of relaxed attitude we have in WA at the moment. We've got to remain paranoid. Then personal protective equipment. Why is it that I keep seeing cleaners on the TV who have better gear than what I see the ICU doctors are allowed to use. And I know that there are people in WA who are working hard looking at this at the moment to ramp it up. But come on guys, this is a number of months into this crisis now. Once this thing starts to spread, it spreads real quick. No consolation there for the Victorian healthcare workers who've already been infected in the workplace. So we need proper masks. We need to know the masks fit. If a miner has to wear a face mask, it has to be fitted to them. This all should have been done months ago, and the government's only just now talking about it. So let's get it happening. We don't want to worry about whose fault it is. Just get it done, and then we can move on. Let's forget about academic committees in Canberra that don't work on the front line, who are trying to say we don't need this and we don't need that. We're the ones who do the job. We know that we need the safe gear. We know that we need the full gowns to stop the droplets from getting on us, and we know that we need the face shields, the goggles, the proper gloves, and a fitted respirator. That's the minimum that someone in the general public would expect that their healthcare workers in ICUs, EDs, general practice are being provided if they're going to be treating COVID patients. So let's just get on with it. Aside from that, the welcome news that the Royal Show has been postponed to next year. Sorry that it won't be happening, but good to see that the community is having some respect, some humility, understanding that this disease can easily get away from us. So let's celebrate the luxury that we have here at the moment, being able to enjoy our lives pretty freely, but let's not gamble it all away. Let's be careful. Thanks for your time.
And that's all for this week. We'll be back with another episode of WP next time, but until then, it's back to you, Ivan and Taylor.
Thank you, Nelson. And that's our weekly news and current affairs. For news anytime, you can visit our website and social media pages.
See you next weekend. Good night.
Wish you good health and take care.